Point one, just one more second. I feel like I just have to make sure the other live stream is good. Okay. So today I'm going to be discussing ways that we can stay healthy during COVID-19. It's a very odd situation where we're sort of stuck inside and we hear a lot about physical distancing, but it's very, very easy for us to, get lost in all the information that's coming at us and also, pick up some more unhealthy habits during this time as well. So we can use this time for our advantages. We can use it to our advantage by making sure we pick up healthier habits and stay healthy. There's also a lot of misinformation going around about the coronavirus, so I'm going to touch on a little bit of an update on the coronavirus as well to make sure everyone knows what's going on, understands at least the severity of the situation, and how we can make sure that we're staying well informed while moving forward. So what exactly is going on? And I'm going to start talking a little bit in context of the clinic as well. A lot of you might have received newsletters or checked our website or received phone calls from our clinic staff and team. Um, but essentially, so at the time being, all in-person appointments and in-person workshops are canceled. But we are doing phone appointments and we're going to do online workshops like these. So hopefully, we're able to smoothen things out a little bit moving forward and we get comfortable in what we're doing. If you do have an appointment coming up in the next few weeks, we're going to be hosting a phone call appointment instead of in person. So you might receive a call from Dr. Cunha. Dr. Cunha is telling us some funny stories where, some people thought he was a fraud, or some people thought that he was just their friend that was pranking them. So no, Dr. Cunha will be calling you and our team will be calling you if you do have an appointment coming up. So with
So you
that being
might get a
said,
call from a number from Vancouver. We have some of our students calling from them. You might get a call from myself. And we are going to, at times, bring in some people that we need to see. So we think the vast majority of what we can do can be probably done remotely, but sometimes we're going to think about bringing people in. Um, we're going to actually start some testing on selective people as well. So you're going to, this is in a state of flux. So, what we say tomorrow, today, is important. I will just say that one of the best rules is the 6 foot rule: is stay 6 feet away from people that you don't know, and wash your hands a lot. But we'll get more to start off on how to be healthy. Is that mashup picture going back on there at some
yeah,
point?
yeah, it's right here.
So MASH, um, for us old fogies, is that I think one of the reasons I became a doctor is on Friday nights. Our family in my parents' bedroom, we would all watch MASH. MASH stands for Mobile Army Surgical Hospital. I think many of us want to become a Hawkeye Pierce. Um, and so to me is that lots of good stories, and so instead of Mash tonight, you're gonna be talking to Paul and Greg tonight, or
Yeah.
Dr. Greg.
And again, I would just want to reiterate if anyone has any questions at any point, don't hesitate to stop us. You can either send a message or if you're in the WebEx call, you can just say it out loud and we
Is
can
that
sort
like
of
Chrome?
work with that as well.
Yeah.
Um, so here I'm gonna start off by talking a little bit about COVID-19 and what's going on. Like I said, there's a lot of misinformation around what's happening, so we have to be sure that we are sort of clear with what's going on. So today, the number of
Click here
cases did
to
reach
install
above a million.
web.
That's as of today as well. The death rate is still rising, or death toll is still rising as well, and we're going to get into groups that are perhaps more at risk or groups that should be a little bit more careful as well. But yes, today marks a day where we've reached above a million. Now, with that being said, majority of the cases are mild, and we'll get into that. Canada itself reached
Here.
12,000,
We put
Your
your
full
name.
name.
Put Joanna
and
Hill.
Why don't I put you?
Army
all
in
right,
this
so
one.
Canada itself reached 12,000, and you can see here, um, the number of cases per day is still going up, which means Canada is still, we're still in a position where we have to be a little bit careful with our distancing and make sure that we're not coming in contact with too many people. Um, yesterday, we did see a spike in the deaths. Luckily, relative to A bunch of other countries, we're still a little bit on the slower end of the curve so far, but we can start talking about who's perhaps more at risk or who should be careful as well. And this is where I believe a lot of good information comes from here. So, according to the World Health Organization, the people who are most at risk are those aged 65 and older, particularly those living in a nursing home or long-term term facility. We're going to talk about comorbidities as well. And people who have to be particularly careful are those who have traveled recently or been in contact with someone who's traveled. This was, the case. This was the case a couple weeks ago, but at this point in time, we're also worried about community transmission. So this means from this point in time, you may not only or you don't only have to be careful of those who've traveled, but we also have to be careful of those in the community because the virus is out in the community now. It's not only coming from individuals who have traveled. So here we have some case fatality rates, and all of this is still, it's still very new. So all of the information is coming from either Italy or China. You can see that the younger individuals aren't at much risk. However, it's this age group here that we have to be a little bit more careful of in terms of fatality. So the above 60 group, the above 70 group, above 80 group is where things start getting a little bit more serious. Now, in terms of the fatality rates, like I said, majority of the cases are mild. You do see some severe and critical cases, and it's these critical cases that come from this larger, older age group here as well. So you can see in Italy and China, both of them, regardless, you have that above 80 age group that's at risk. Hospitalizations as well comes in the above 60 age group, but more recently, at least in the United States, they have been seeing that younger individuals have been taking up a lot of space in the hospital and a lot of the beds in the hospital as well. So just because it's perhaps more dangerous for older adults doesn't mean that younger adults don't need to worry as well. And this is why this is everyone problem. It's not just a older adult problem. It's something that everyone needs to be careful of. Everyone needs to make sure that they're not spreading it to other people, and everyone needs to make sure that they're not catching it themselves as well. The virus doesn't discriminate. It can come for anyone. That's why everyone needs to take measures to make sure that we're staying safe.
Well, Paul, it's a good point. Is that when we first heard the experience from China, we thought that it was just the older people that were going to succumb, but unfortunately, age is still a predictor of bad things happening to you. But young people, unfortunately, succumb can succumb to this disease as well. So North Americans are seeing more younger people compared to the Chinese experience, and we're learning. And what I thought I knew before, I have to unlearn and change later. So I think we're all at risk. The better your immune system, the better off you are. And as you get older, your immune system doesn't work as well. So your thoughts on that, Paul? Go ahead.
Yep. Okay. So we can move forward to in USA. So as we know, the States is perhaps one of the more quicker moving countries in terms of the virus. Things have really sped up there, and things have exacerbated. So still in the U.S., like I said, we still see the above 65 age group that has to be careful, but the 20 to 44, this was the group, like we said earlier, the group that people thought we didn't have to worry too much about. They take up about 20% of the hospitalizations and 12% of the ICU admissions as well. And so this is the extent of it, where everyone at this point has to be careful. We do know perhaps some of the younger adults may still have work in essential businesses, or anyone actually may still work in essential businesses, or um, may have trouble staying home. So we have to be careful that even if we're staying home, we're not coming in contact with other people who are still going out as well. So children appear less symptomatic. They're less prone to the severe illness, but that doesn't mean that children can't spread the virus as well. And in fact, I'm going to touch on this a little bit further when we talk about how to avoid the virus and how to avoid transmission. But can touch on this a little further, but so sorry, someone's just echoing there. Okay.
Well, those sound great. Those are people on there. Is that reading your voice directly? If that's what's happening there, Paul?
Sorry.
Reading some of these echoes. Is
Yeah.
everybody else just
There we go. Should be good.
so there you go. So what I'm learning, it's okay. We're all learning about technology, and this is great. So I would just keep yourselves unmute now if you can figure out how to do that. And if anybody has questions, please join in and then put your questions in there. Then mute yourself afterwards. Any questions from anybody as we go along? We have lots of opportunity for lots of discussions and lots of talk. So yeah, let's keep going. Thank you,
Okay,
Paul.
sounds good. Um, so yeah, children appear less symptomatic with the infection, so they may not get the cough, but they're still carriers of it, and we still have to be careful. We just because a child is 12 years old and wants to play outside, sure they may not come back with a cough, but they may come back with the virus as well, and we have to be careful to not let kids go to parks. Parks at this point are closed, but we still do see a lot of reports of people going to parks, and it's a very good hotspot for children to pick up the disease and pass it on as well. So I'll talk a little bit about how to stay safe in transmission later on, but coming back to risk, we do see some information about comorbidities, and this is where you as patients of a cardiology clinic as well have to perhaps pay a little bit more attention to. So we see that individuals with chronic lung disease or COPD are perhaps most at risk or among the most at risk, as well as those with heart conditions and immunocompromised patients. And as such, whether if you do have any of these comorbidities, we can look at this data here. You should be more careful, whether it's diabetes or obesity. Perhaps should you wipe down? Okay, I see one question here. Should we wipe down our groceries? That's a great question. So as of now, there's not a lot of information on whether the virus stays on groceries or not. Would still recommend it. My household has, whenever we bought fruits and vegetables, we buy them in advance, leave them in the garage or somewhere where we're not going to touch them for a few days. I believe the virus stays on cardboard for up to 4 days. Steel is 2 or 3 days. Or sorry, metal's 2 days, plastic is 3 days, and cardboard is 4 days for how long the virus can survive on. So if you do buy groceries and it's in any boxes, perhaps put them to the side for a few days. Make sure you wash your hands as well. We're going to get into that. In terms of the food, we just washed all of our fruits and vegetables as soon as we brought them home. So like
So
there's
okay,
no. Sorry,
that's a
Dr. Lee.
great thought. So basically, is that like you have a can of Coke, it's aluminum. Aluminum. We think the virus can stay alive for 3 days. Yes, you can buy potentially lettuce that's contaminated. There's been to this date no issues about that we aware of that you got sick because of food. But um, talking to a number of people, I think the best thing to do is put your food away for 3 days. The virus will die. Um, so to me, that's not a bad idea to start off. So we have lettuce. So we put the lettuce in the fridge for 3 days before we eat it. Still wash it, but if you put the lettuce in the fridge for 3 days, um, the virus can't survive.
Yeah.
That's the
Yes.
belief right now. And what we know today and we learn tomorrow will be different.
Mm-hmm.
Um, I like this idea about putting food in the garage. We think that warmer temperature kills the virus compared to colder temperature. But I don't think I want to put my lettuce in the garage for 3 days. It'll probably go bad. Where I can keep it in the fridge. Can it be on the plastic? Can it be on the tin? Potentially. But as of now, it's not a big way of transmitting the virus right now. So just take a couple extra precautions there. Anything else you thought of, Paul, about that?
And I guess the only other thing on top of that is, as long sure you can be careful with the groceries, but you still have to make sure that you are washing your hands very frequently and not,
Yeah.
in the middle of grocery shopping when you're outside buying your groceries, you're not touching your face with your hands. So being very careful of the things you touch
Yeah.
as well.
We're supposed to have 5 to 10 servings of fruits and vegetables a day. We should be washing our hands 5 to 10 times a day.
Yeah, sounds
Soap
good.
and
So
water.
Whenever you have doubt, just wash your hands, honestly.
And don't
Yeah,
touch your face.
yeah, and don't touch your face.
It's
Uh,
easier, it's easier said than done.
yeah, I believe the average human touches their face hundreds of times a day, so it's very, very hard to stop. But with that being said, it's something that perhaps as we're more careful or as we spend more time thinking about, we'll get into that. I do see one question about masks, face masks. I'm gonna put that on pause for a sec. I'll come back to that later on in the presentation because I do talk about that as well. But back to the comorbidities and those at risk. So having one comorbidity, whether that's heart disease or COPD or diabetes, puts you at a 80% higher risk of death, and having two plus is 160% higher risk. And this is data from China as well, China and Italy. So COPD is one that we have to be particularly careful of because that puts us at 2.5 times the risk compared to no disease. So, if you are smoking, perhaps now's the time to use it to your advantage and try quitting. You have to be very careful of your lungs in this time of the crisis because the coronavirus is a lung disease as well. It's a lung virus as well. It affects your lungs the most. Um, Diabetes and hypertension also put you at risk,
So to
so
go
high
back
blood.
to COPD, first of all, I think there's, what are ways to getting healthier? One is that COPD stands for chronic obstructive pulmonary disease. That diagnosis is made by a breathing test called a spirometry. So many of you have had your lung ages, so be aware of that. Historically, 5 minutes of life is lost every time you light up. I can't think of a better time to work on smoking cessation. So if you smoke, um, let's work on trying to stop. Now, there are things from nicotine gum, Champagne, Zyban, they can make it a little bit easier to stop smoking, but A, you have to be motivated, and two, that make some changes. For those who want to change the behavior of tobacco, a couple things I think you should think about doing is that if you smoke with your right hand, only smoke with your left hand. Um, don't buy your tobacco on the reserves. It's probably the worst tobacco possible. Write down every time you're having a cigarette and always smoke in places that you don't want to. So go outside, go in the middle of nowhere, be safe. But really, it's time to make an intervention. I understand it's hard, um, and I want people to try really hard about that. Paul's going to tell you about diabetes. The best way, if you have early diabetes, to put in remission is to lose 20 pounds. Um, I know it's not easy. I'm losing weight right now. I'm down to 170 right now. I'm going to get down to hopefully 165 pounds. I'm going to try to keep it off. It's hard work. Um, so weigh yourself on a regular basis. Go ahead there, Paul.
Yep. So the next ones that we should talk about are diabetes and hypertension. And like Dr. Kearney said, wear yourself and losing weight is probably one of the best things that you could do for diabetes and hypertension. If you have high blood pressure, if you are diabetic, you are at about 1.5 times higher risk for death due to the coronavirus as well. So, similar to COPD, no better time to perhaps work on your smoking. There's no better time to work on your weight as well. It's very easy knowing that we are almost like we're home. We're really not allowed to go out too much. We have to be careful of coming in contact with others, and you can imagine with all of those factors, it can be really, really easy to put some weight on the belt as well. Um, so, like Dr. Kearney said, best thing that you can do for diabetes and hypertension is aim to lose 20 pounds. That's not going to happen overnight, but it does start with wanting to make a change. So, are you motivated? Are you setting realistic goals for yourself as well? And we can get into some smart goal setting too. Um, but perhaps trying to lose some weight is going to go a long way. Move up towards a lot of vegetables, so eat 5 to 10 servings of vegetables a day. I'm going to show you what a typical plate should look like as well. Um, and yeah, so just work on eating healthy, work on staying active, and that's probably some of the best things that you could do for the risk of diabetes and hypertension.
So it's kind of interesting. Today, the disease right now is COVID-19. Tomorrow, I'm tired, I'm too busy, I have too many commitments to work. We all have our excuses. So it's time to, dial it up a notch a little bit. And to me, we're all going to have our ups and downs, and we're all going to not always be successful. And yes, it's okay to be scared. It's okay to not being successful, but it's time to just try a little bit harder. Now, one of the risk factors that I don't quite understand is why just having high blood pressure should increase your risk of this disease killing you. First of all the data that you're seeing over here we call association data. So it means beds are associated with death, but beds don't kill us. So these does not necessarily mean it's going to be causal effect, but these are things that are associated with a higher risk of dying from this disease. Doesn't mean it's going to happen. It doesn't mean they're all right as well. So we have a lot to learn. So what I'm doing right now is that when I call people up to say my blood pressure is good, measure your blood pressure. If you don't have a blood pressure machine, think about getting one at some point in time. You're now going to have to be partners in health. And one of the things that I think we're entering an era. I read this wonderful article from one of these young residents who says, we don't have rights anymore. We don't have rights to anything. We just have privileges, and we should be very privileged at this point in time. And I'm kind of thinking along those lines too as well. I'm very privileged. I'm very fortunate. And I'm going to try harder to be healthy and to make you as healthy as we possibly can. And we're going to work together. Go ahead there, Paul.
All right. And there's one question we see from YouTube as well. If you feel that you have any symptoms, especially a cough, can you use a puffer like Symbicort? Dr. Cooney, do you want to speak on this?
Yeah, so we have coughs for all sorts of reasons. If you have a cough because you have underlying COPD lung disease, so you could take your normal puffers. If you think you're having cough because you're having an infection, the puff will be less chance of being successful. So that's very much an individual variation. One of the things that's clear to me is that we get short of breath for all sorts of reasons. I'm overweight, I'm deconditioned, I'm depressed, I'm anemic, I have lung disease, I have respiratory failure, I have COPD, I have pneumonia, I have COVID-19. So it's really there's not one simple solution to everybody. Is there a change in pattern? Is this outside your normal pattern? Um, if you feel very short of breath, especially if you have a temperature, um, that may be a place that you need to think about being in the hospital for evaluation. If it's a normal shortness of breath because you have COPD or asthma, then you can treat it with the puffers. So it's that common sense approach, and certainly if we can help you with that in any way, there's ways of getting hold of us. As calling clinic. I thank Jen for keeping the phones. She's answering the phones mostly from home at this point in time. And then we had the email address to drkernew at 232gmail.com to keep in contact. So there's not one simple approach for everybody. So if you have a puffer from your lung disease, take it. Uh, it the simplest puffer first to start off with is that blue puffer called Ventil. But there's a whole series of puffers, so very much an individual variation decision process.
Right. And I guess one of the important things as well is if you do feel fever coming on, it's a change in trends. It's not something that's usual for you if you feel a fever. Then perhaps it may not be your lung disease that you had before, and it may be symptoms of COVID-19 and might warrant testing as
So it
well.
could also just add the common flu. So
Hmm.
fever is a marker for infection for most of us. So you have to decide if you're not feeling badly, and again, many people have mild symptoms. You isolate yourself. Um, if you're bringing up dark phlegm, you're shaking all over, you're really coughing a lot, that might be a bacterial infection. Or could and like a flu is sort of a gradual dry cough. Influenza is more muscle ache. So it's working through your symptoms and deciding what you need to do. Remember, viruses don't respond to antibiotics. Bacterial infections respond to antibiotics. So we're using a lot more antibiotics. Probably we're overusing it careful about that, but I think many of us will try to err on over treatment at times, but we have to use that sort of, make a diagnosis with your physicians and also your common sense too as well. If you have the sniffles, a mild cold, just isolate yourself. Use that 6 feet rule.
Right.
If you need to speak to physicians, speak to physicians. If you're really sick, then you go to the hospital.
Yeah. And there's one more question related to that. Do you know what hospital one should go to in Hamilton, Dr. Kearney? Does it matter?
Well, what's happening is all the hospitals are changing. So what's going to initially, I would go to the hospital you normally go. If COVID gets very bad, I know the Hamilton General Hospital is going to be one of the main centers. I think, and the same thing with St. Joe's, if I remember correctly, is that they're trying to keep the COVID patients in one institution if they can. Again, most people who get COVID-19, the symptoms will not be excessive. And if you're very sick, you obviously have to make your way to the hospital. You don't make it to doctor's offices. Doctor's offices don't really have no way of protective gear. We're going to be opening up our office to people who we think their hearts are concerning, that we need to evaluate that. And so what we plan to do if we bring people in is that you're going to come in one at a time. You're going to be in your car. And if you have any flu-like illness or temperature, we don't want you to come to the office. We don't want you to infect other people. And we don't want to be able to put our whole office into quarantine. So we'd like to help people with heart conditions. So we're going to do that selectively. So there's a number of people that we're trying to come in, but that's going to change. And it's an individual decision we'll have to make with you yourselves. Remember is that we all have a responsibility to be citizens and to be helpful to all of us. And I think if we all work on trying to make this world a better place, the virus will pass much quicker. If we just think of our own selves and not worry about how we can affect other people, we're going to face a much longer repercussions from this. So I think the world's changed, and I think the world will change for the better at the end of this. We're all forced to do things differently. Um, and no one wants to be in this position. There's certainly lots we can learn, and um, learning how to use telemedicine better. The government has made that easier to use. But we still have a lot to learn, and I'm doing better now than I did a few days ago with this. So we keep learning.
Right. And there's another question from Andrew. Will I need to get extra prescriptions for my meds since the drugstore is limiting pills? If you do need prescription refills, you can give us a call or you can email us at drkearney232@gmail.com. And Dr. Kearney can actually fax prescription refill to your pharmacist as well, provided that it's medications that Dr. Kearney had prescribed.
Yeah, so one thing to remember is that Paul and I were kind enough to do another little webinar on how to prepare for a visit. And if people want to listen to that YouTube video, how do they get a hold of it? How do people get to that, Paul?
It's just on our YouTube channel. It's about a 30-minute long video called "Preparing for Your Phone Appointment" or "Phone Appointments at Dr. Kearney's Cardiology."
So if you go into YouTube, when you get to YouTube, what do you do?
You just type in Dr. Kearney and search, and it should be one of the first ones there.
Okay, so we have a YouTube station with all sorts of different videos. Please take a look at them. Please use them. The most recent one is how to become an active person in your health, how to prepare yourself. And obviously, your pharmacist is a key person too as well. Your pharmacist can fax over a prescription request to the office. What we need to get a prescription to you, we need to know the fax number of the pharmacist. Now, we have most of the pharmacist fax number, and the address is important. We can find that, and we'll get that sent off to you. Um, and now, one category of medications that are on back order right now are medications called ARB. Um, and those are medications that end in can, Atican, irbesartan. Um, these are medications that are hard to come by, and they've been on back order for a while. So at this stage, I'm going to try to avoid using too many of these can medications and replacing with pills called krill, ACE inhibition. So we might have to make some substitutions right now, and we'll just go ahead and do that. My traditional prescription is usually for 100 days of 3 refills. So now, what the pharmacist tends to give for the first new prescription is 30 days. Um, Maybe you'll get a 100-day prescription, but really depends on the stock of the pharmacist. So um, we'll just see how it transpires.
Right.
Uh, just be healthy, um, and this is a good time to think about um, what medications are truly important, how to use them properly, and know why you're taking them. So one of the things that we're opening up is that we have on a Google hard drive thousands of pages of information. When are we going to make that available, Paul?
I'm planning on doing that this weekend.
So Paul is in a group of us. I've been running for 25 years. I am, and we're busy editing, and things are not everything's a work in progress. So we're going to open to you um, thousands of pages of health information. One chapter is on medications, and how many pages is that there, Paul? Around 600?
600, yeah.
Yeah, we have 600 pages of medications, and what that means to you and translate it to you. So it's, we want to provide you, right, hopefully, is good information. I was just reading or just listening to a podcast right now on reading is a good thing. So we got some stuff for you to read.
Yeah.
So you have to think.
Okay. I think reading is a great way to go, and so the question was prescriptions. You can watch our video on how to prepare for a phone interview, but keep yourself busy at home. Read. It's a good way to learn a lot. We'll make that available, and we're gonna also host a lot of perhaps meetings like this in the future as well, where we can connect and answer any questions you have, and hopefully continue the learning process at home as well.
So one of the things I keep learning from all you wonderful patients out there is that I was speaking to an individual who's lost about 75 pounds. Um, and now he does it a different way than I would do it. Um, but he's been on a fast where he's just drinking water and lemon. Um, I It's not one of those things that I think is the right way to do things, but I can't argue with its success at 75 pounds. And so we're keeping track of him, and he's making good progress there, but he's working on it. For me, I have an appetite. I'm always hungry and can eat at nighttime. And if I, and for me to lose weight, I always have to be hungry. I have to restrict calories, I the right foods, and I have to avoid um, what I call the cocaine equivalent is white sugar and white flour, and have to exercise like a fiend. So right now, I'm, I'm, when you hear about this, stay inside, that's a great idea, but I live in the country, and I can go out and bicycle for 1 to 3 hours every day, and I'm going to do that. And I'm not quite sure if this comes through over here is that this is a couple over here that with myself and Jim, we do the Ancaster Paris race. Uh, and so I love these little cups where you try to be physically fit. And I need to become fitter. I need to be better. And I think we're all getting better. And thank everybody for trying to figure ways to be healthier. And yes, there's always obstacles, but there's always solutions. And if you don't succeed, try again. So we'll keep trying.
Nice. Perfect. Okay. Very briefly, I'm just going to touch on what COVID-19 might look like in terms of presentation. One thing that I do want to stress, however, if you truly, are just worried or don't you may not actually have COVID-19 and you feel like you're just worried and want to go get checked out, I would recommend, only going to the hospital in cases where you're almost sure of having COVID-19 because you're more likely to pick it up from a hospital emergency room than anywhere else at this point. So unless you really need to go there, whether it's for COVID-19 or anything else, try not to go to the hospital for the sake of just having a little bit of a worry or panic attack and going there to check it out. If you do have any questions, the Hamilton Public Health or Public Health for whatever area you're in is has phone lines running day in day out where you can call in. They have assessment tools to see how things are looking. But most of the time we see a fever, cough, and shortness of breath, and as well as a little bit of fatigue. So those are the most common things and things to look out for. If you are experiencing any of these before going to the hospital, I'd say call, unless it's an emergency case where you feel like you actually can't breathe and it's a very urgent situation. You can call public health. They can do an assessment for you.
But also
Um,
say if you're, let's say you do have COVID-19, so and you have a non-severe case, which is the vast majority, isolate yourself.
yeah.
Um, you will get better the vast majority of the time. So just because you have a fever, just because you're coughing, and you don't feel too badly, is you isolate yourself. Um, and that's the current wisdom at this point in time. It's when you really feel my shortness of breath is really getting problematic. That's the time to try to seek more medical care, more conditions in that circumstance. Um, you know, 3 weeks ago, if you had a cough, sniffing nose, you just went to work sometimes, and now we don't do that anymore. We isolate ourselves.
Yeah. Okay. So transmission, like we've been saying, it is largely a lung disease. So a lot of it is transmitted through uh, respiratory droplets, and what that means is through a cough or through a sneeze. It's very airborne at that point in time. The reason why we say 6 feet of distance is because that's usually the amount of distance it takes for those airborne droplets to reach the ground as well. So you can keep yourself 6 feet away or 2 meters away from other people. If you do have any coughing or sneezing, make sure you cover your mouth and cover your nose. Be careful of saliva. You don't want to be. It's now's not the time, I guess, to be sharing straws with your best friend. um, and asymptomatic people are, those who have the virus but don't present any symptoms. So they're not coughing, they're not sneezing, and there has been evidence that the virus does transmit from people who are asymptomatic, but we don't really know the degree of that as well. So
So
on,
I just learned something that when you when you when you cough out these respiratory droplets, they're small particles, they're mid-sized particles. They usually fall within 1 to 3 meters from you. So that 6 foot rule is important. So what hospitals, one of the lessons we learned from Italy, um, unfortunately, the people that died, the physicians and the nurses, weren't particularly the ones looking after the COVID patients because they were in gowns and masks, they were protected. It was the people in the hospital taking care of the non-COVID patients who were touching the doorknobs and the other parts that got contaminated with that. So that's why there's hand washing. So in theory, if you have it on your hands and you don't touch your face, you won't get it in theory. Saying that is that I think we all touch different parts of our body. So that why that frequent hand washing, keeping surfaces clean is important. And this disease can potentially go away in 2 to 3 weeks if we were purely isolated ourselves. And so there are ways of preventing spreading from this. And I think it's important to realize that. Um, um, and Yeah, good description, Paul. So you can be totally asymptomatic, or you can have just a cough. and a low-grade temperature.
Right.
Obviously, if you get very sick and go to multi-organ failure, um, that can progress quite rapidly, and that's why if you're really sick, go to the hospital. If you're not very sick, stay at home in between. Just make judgments with your healthcare team.
Right. So the symptoms of, if you are infected, the symptoms of the infection do, in most cases, appear within the first 7 days. However, you can go as long as 12 or 14 days without showing the symptoms as well. So that's why for quarantine, we say, 2 weeks of self-isolation, 24 days, so a little bit further would be preferred. Viral shedding, I see a question. The viral shedding just means transmitting the virus from one person to another person. And there's another question here. In most cases, can you come away from COVID-19 with damaged lungs? So, like we showed earlier, about 80 to 90% of the cases are mild. So even if you do catch, it'll just be a little bit of a fever, a little bit of a cough, and that's the end of the story. And perhaps more severe cases, it's when it starts to affect the lungs a little bit more, but that's just a small percentage of the population. One thing, or
In fact, maybe even we're not detecting all the disease, right? We only have the ability. Our testing is being ramped up, but we're only testing a very small number of people, um, and so there's probably a lot of disease that's relatively mild and not we're not even aware of.
So a couple of things that are interesting, but we don't know too much about them right now. One is that apparently children and between families is a large source of spreading. So don't let your child or grandchild go to the park at this point in time. They can perhaps play at home for the next couple of weeks before they head back to the park. And be careful of seeing families. We understand that a lot of you might want to go visit families if you don't live in the same household. But you have to be careful with perhaps contaminating or spreading through that source of transmission as well, because that's been shown to be a source of spreading of the virus too.
What's important, Easter's coming up, and grandma and grandbabies shouldn't get together this year. I know it's a bad thing to say that, but that's the right thing to do. Yes, you have to live your life and live it safely, but one of the things that in hospitals, usually doctors get together with all their residents, so residents and then 7 students, and we'll be all bunched together. We don't do that anymore. So I think there's ways of staying safe. So my best way of staying safe is is to make myself stronger. So we learned from Paul that being overweight, having diabetes, having high blood pressure, smoking makes us sick. Or if we get sick, we die more. So what I'm doing right now is I'm trying to get in the best shape of my life right now. Um, I'm exercising. I'm exercising safely. I'm exercising by myself. I'm really ramped up my eating behavior. I'm watching my weight. I'm spending uh, time being healthier. I'm going to work with you to be in communication with you. Um, if you smoke, please, please, please try to stop, try to reduce, do something. Um, that's important. Um, one of the things that we should talk about is that if this disease gets very bad, um, or we get very sick, we're going to run out of respirators. We don't have enough of anything. Um, so is that I hear if I have heart disease, if I have congestive heart failure, I have atrial fibrillation, I have diabetes, and if you get sick and you need to go to the hospital, um, think about you want to be on a breathing machine or not. People who go on breathing machines have about 50-50 chance surviving, and it's usually the younger, healthier people that have the best chance. And dilemma that I thought about, I see Phil and Joanne out there, and one of the things we talked about is that is should I go on a respirator or should I go to a 20-year-old? And those are decisions that I need to think about. And at some point in time, is people who have the best chance of survival will be given that option. And I'm not saying it's going to come to that, but it also makes me appreciate what I have. Um, I've been very lucky to serve you, and I hope to be around for a while. Um, and I really want to thank all the people out there, from all the healthcare providers to the firemen to the police, the people in the stores that are still working and exposing themselves, the people, um, are filling your gas tanks, and the people who provide the groceries. Those are the heroes. And I'm very grateful for that. And I'm very grateful for all of you for taking steps to be healthier and to be responsible as well. And I would never predict it to happen. But then again, it is what it is. But I'm learning to use computers better, telemedicine better. Um, I think medicine will be a hybrid of telemedicine, phone conversations, and patient visits. Um, and we'll see how that turns out. I'm just trying to get better and healthier every day, and I know you are too as well. And if we all just help each other out, this will pass quicker than you think. Go ahead there, Paul.
Right. So like you said, I think one of the important things to keep in mind as well is there is positives to everything and plus sides to everything as well. A little bit more of an optimist or optimistic mindset. So, sure, things might be a struggle right now, but ultimately, we're going to learn a lot from the situation. We're going to come out stronger, and things are going to change, and perhaps change for the better as well. So I'm going to talk a little bit about staying safe. I watched this really, really interesting video. So I'm going to show you this small little video.
You know
about
that the
washing your
best
hands.
way to prevent the spread of coronavirus is to wash your hands.
Wash your hands.
Wash your hands!
But why? It's because soap, regular soap, fancy honeysuckle soap, artisan peppermint
the
soap,
virus
just
is killed
any
quite
soap
easily by
absolutely
soap and water.
annihilates viruses like the coronavirus. Here's how. This is what a virus like coronavirus looks like.
During a Christmas
It's a
meal,
bit
my
of
uncle,
material surrounded
when
by
I
a
was about
coating
12
of
years old, took us
proteins
to
and
the bathroom and
fat.
showed us how to wash our
Viruses
hands.
easily stick to places like your hands, but when you rinse your hands with just water, it rushes right over the virus. That's because that layer of fat makes the virus behave kind of like a drop of oil. You can see it happening in this demonstration. Oils are just liquid fats. What happens when you pour oil into water? It floats. It doesn't mix. But add soap.
Is there any sound to this?
Yeah, can you hear it?
I can't hear any sound on this.
And suddenly that fatty oil dissolves into the water. That's because inside, soap has two-sided molecules. One end of the molecule is a
Just saying. Are you able to hear the sound there or no?
I couldn't myself, but that doesn't.
Can those watching hear the sound? If you just message in the YouTube chat.
So basically, wash your hands for about 30 seconds. Cold or hot water. Use lots of soap. Do it often. Do it regularly.
Yeah, so Dr. Deacon said he could hear the sound.
attracted
so
to water,
I'm just gonna keep
the
playing
other
it in.
end to fat. So when the soap molecules come in contact with water and fat, these dual attractions literally
Maybe make some
pull the
comments
fat
along the way or
apart, surrounding
follow.
the oil particles and dispersing them through the water. Let's go back to our coronavirus molecule with that layer
So I'll
of
just
fat
recap
holding
it
everything
again for those
together.
who couldn't hear the
When it
sound.
interacts with soap, bam, that fat gets pulled out by the soap. Soap literally pulls apart and demolishes these viruses. And then the water rinses the harmless leftover shards of virus down the drain. But, and you know where I'm going with this, it takes time for this effect to happen. 20 seconds to be specific.
So
To
you gotta
show
wash
why,
your
we
hands
ordered
for-
this lotion that mimics viruses and their fatty layers. It glows under a UV light. If you just rinse your hands under regular water, nothing comes off.
So this is a soap that
If you
glows
wash
in
with
UV
soap
light.
for just 5 seconds or 10
So,
seconds,
remember next
your
time you
hands
go
are still
to,
covered. The virus is
remember
still
those
there,
stores
able
where you
to
used to
get
get the
you
jelly
and
beans and
others
stuff
sick.
like that?
But
I don't think I'm ever gonna get a
24
jelly bean
seconds.
ever again.
Now the soap is
Sugar
actually
kills
destroying
you,
the
and
virus.
it's too much
Hand
contamination.
sanitizer
Yeah.
works too, because it's mostly alcohol. And alcohol
Keep
works
soap
in a
in your
somewhat
pocket.
similar way to soap, breaking down that fatty layer. You need a high concentration of alcohol to make that
So
work.
before you
The
start
CDC
any
recommends hand
relationships with
sanitizers
anybody,
with at least
when was the last
60%
time you washed
alcohol.
your hands?
But even with 60% alcohol, the CDC recommends using soap if you can. If your hands are sweaty or dirty when you use the sanitizer, that can dilute it and diminish its effectiveness. As for soap, just any old soap works.
And
You
again,
don't
for
need
those who
soap
can't hear
marketed
the
as
video, I'll recap it
antibacterial
at the
even.
end.
The FDA says skip it. There's no proof it's any more effective. Just be sure to wash your
Plain
hands
soap
for
and water.
20 seconds. That's happy birthday
20
twice,
Happy birthday, dear. I guess me.
or the chorus to Lizzo's Truth Hurts,
Straight to my face.
or Prince,
So choose your favorite song and just
or
sing it while
Eminem,
washing your
Go,
hands.
go, only go.
or even Dolly,
Jolene, Jolene, Jolene.
just as long as it's 20 seconds. And
Here's
you're
a
using
question
the
for you.
ultimate
One of those
virus
guy things is that you touch yourself down below where you're not supposed to. Does that transmit the disease anywhere, Paul?
No, I wouldn't think so. Maybe other diseases, but that's not the coronavirus. So what's really interesting is here, I thought this was very interesting, where if you look at here, they used a lotion, so very much like just fat or oil that glows in UV light. Washing your hands for 5 or 10
You know that
seconds didn't completely wash it off, so you gotta wash for the full 20 seconds. Um, so any soap, it doesn't matter if it's antibacterial soap or not, just choose any soap. Make sure you wash your hands for 20 seconds at least, because 5 or 10 seconds, it's still on your hands. You haven't got it all down. And then rinse your hands down. If you're using hand sanitizer, look for anything with above 60% as well
60% of
of alcohol.
alcohol. Thanks. Not the drinking one.
Yeah,
Alcohol's no good.
yeah, no, not the drinking one. We don't recommend drinking alcohol to prevent COVID-19. Okay, so make sure you wash your hands. When in doubt, just wash your hands is my rule of thumb now. But after, I guess technically after blowing your nose, coughing or sneezing, after going in the public, anywhere in the public, just give your hands a quick wash. After touching anything outside of your home, including money, I've seen a lot of videos of people washing money now instead, because
You know what's
thanks,
interesting is that money is actually plastic.
yeah.
I didn't realize that.
Yeah,
So
yeah.
you're,
So
you're
they changed that not too long ago, like within the last sort of decade or so, they've switched to the plastic money. Um, but yeah, so the plastic money is washable. So I know a lot of businesses have been washing their money. If you are around anyone who's sick, make sure you wash your hands, and before and after eating, wash your hands. So these are on top of reasons why you would already wash your hands anyways. If you go to the bathroom or if your hands are just dirty or you touch something dirty, you should be washing your hands. But when in doubt, whenever you're in public, make sure you give your hands a quick wash and be sure not to touch your face without washing your hands as well. So we talk about distancing, and the reason why we are really stressing this physical or social distancing is because there's only so much capacity in the healthcare system or in hospitals. This disease is spreading very, very quick. Now, we don't want a whole mob of people running into the emergency room at one time because there's no way that there's enough beds or enough equipment or enough doctors to treat all of you. Money laundering. That's a funny joke. Yeah, I guess this is the one time that money laundering is acceptable.
so pay by credit card.
Yeah, yeah. So, way to go! Right now, they're recommending if you are paying for anything, pay with tap if you have that on your phone, on your card. Um, yeah. So distancing, I found this really, really cool simulation. I'm just gonna speed this up a little bit, and I'll talk over this as well. There's no sound to this one. You can see this is what it looks like when you aren't socially distancing. You can see how quick the virus moves, it spreads, and here I might just slow that down a bit. See how quick it moves and see how quick it spreads. Now this is with people who are quarantining for a little bit. You can see it spreads within the quarantine quick, but those who are outside of the quarantine, it's a lot slower there. So the curve is a lot smaller um, compared to the curve is a lot smaller compared to before. Now with some distancing, you can see these people who are not moving, these are all people who are staying at home. They're not going outside. You can see this is a lot slower than the first case where the viruses took over the entire screen within the span of, a couple seconds. And there's this last simulation here where a lot of people, so all these dots that aren't moving are people who are staying home. You can see only the few people that are moving around are perhaps the essential businesses or healthcare professionals. Even if they do contract the disease, the amount of people they infect are a lot smaller because, if you imagine on a normal day, you go to work and you come in contact with 5 different people, but when everyone's socially distancing, you only come into contact with one other person. And instead of spreading it to 5 people, you only end up spreading the virus to one person. So distancing goes a very long way. Um, Hopefully that the simulation helped as well to help understand the goal of distancing and help understand the goal of not coming in contact with too many people. There's this other video from Alberta Health Services about physical distancing too. So that's pretty much the same thing. So it spreads from person to person, but as we spread out, the infection is a lot slower and it's a lot harder to get to other people. So maintain a distance of 2 meters or 6 feet. Work from home if possible. Avoid social gatherings. So I know a lot of municipalities are actually passing bylaws, and Ontario itself passed a bylaw or a law of no more than 5 people. If things do get bad, they might even drop that down lower as well. Stay in virtual contact with your family members. So we're going to talk about that too, and that's how you can stay healthy and stay socially healthy during times like this as well, because making sure that you stay connected is very, very important. So funny story, I'm from Brampton, and recently our mayor or our municipality passed a bylaw of being able to charge people for not or failing to distance themselves. So, anything that doesn't align with the provincial laws at this point is warranting or is worth a charge as well. So, some people just weren't listening, and they ended up throwing a backyard party outside of over 20, 25 people. The police showed up to this house, and they actually got uh, not even a charge. It's going straight to court. They're potentially facing up to $100,000 charge as well. Because at that point, you're not only putting yourself at risk, but you're putting the entire community at
People.
risk as well. Yeah, exactly. And those 25 people are going to go see 5 other people. It's going to turn to 125, right? So making sure that we're staying safe, and we're also doing our due diligence to the community by not trying to spread it to others as well.
One
Um,
of the things I just yeah, that's just one thing I just learned there. I was looking at my face. I'm putting my hand by my face, and I just get that way, and I have to cut off my fingers there.
yeah, I think
I
during
see
this
some.
entire video, I've been
Mike, I see
touching my
you're
face.
rubbing your head there. Be careful.
Yeah, I think throughout this video, I don't know if the camera's on me or not, but I think I've been touching my face as well.
No,
Sure.
you've been very good, Paul. I've been seeing
Wash your
that.
hands.
Yeah, make sure you wash your hands as well. So the Public Health Agency of Canada released this sort of preparation on how to prepare for staying at home, because they're sort of saying we don't know how long it's going to be that we should be staying at home at this point. Could be a couple weeks, could even be months, as Prime Minister Trudeau was saying, depending on, and it really depends on how we as citizens and the community react as well. But make sure you have non-perishable foods, so foods that can last a long time. That includes pasta and pasta sauce. So if you are going grocery shopping soon, make sure you get food that's not going to go bad overnight or in too long. You get what you need for your hygiene. Toilet paper might be hard to find sometimes, but you just look for any alternatives if you can't find toilet paper. Make sure you buy the soap. That's essential at this point as well. If you don't have a thermometer already, it might be worthwhile to look for one so you can actually check if you have a fever or not. As well as anything that you need to just live at home, such as cleaning stuff. So perhaps start buying what you need. Be careful not to hoard too much though, because we have to keep in mind that there are going to be other people looking for a lot of this stuff as well. So I saw this one video where this one house was hoarding like 50 boxes of masks, and the FBI actually came in and confiscated all the masks that they were hoarding because the hospital needed them. um, And masks, so comes to the topic of masks. Uh, do I need masks? So you don't need a mask unless you are symptomatic and you're putting other people at risk. So unless you have a cough or a sneeze or symptoms of the disease, you don't need a mask. So leave the mask for the healthcare professionals. Don't hoard the mask. There is quite a bit of shortage. President Donald Trump is telling companies to stop giving masks to Canada now at some point. So the healthcare professionals are going to need the masks, especially in the hospital. Um, there was a comment earlier about homemade masks. So homemade masks are, I guess, you got to use what you have. Unless you're symptomatic, though, they're not going to do too much. It's not so much about stopping the disease from coming to you as it is to spreading to others at this point. It's the healthcare professionals who are going to be going from one patient to another patient to another patient that should make sure that they don't have the masks as well.
It's kind of interesting is masks are going through different evolutions. So some countries, Czechoslovakia believe very strongly in everybody wearing a mask. Um, Reality in Canada is we don't have enough masks. Um, there's Masks are to protect yourself. The best masks are called N95 mask, which you can't get very easily, and just a regular surgical mask is that so you don't spread the disease to other people as well. Um, an ideal world, it would be nice if everybody had a mask, um, but we don't, and we don't have enough. Hospitals don't have enough. Um, you want your healthcare providers to have tools that they need. But I think we heard you don't need masks, you need masks, and I don't think we really know for sure. Um, what I need to do is I just learned I'm just touching my face too much. I'm just looking at myself right now, so I need some sort of way of reminding myself. And I think you're better off with a bar of soap and washing your hands for 20 seconds 10 times a day than you are wearing a mask. I think the mask gives a false sense of security, and also how to put them on and off, especially how to take them off, are quite important as well. Um, if you do have a mask, keep it, don't throw it away. You can dry it with a hair dryer, but don't burn the rubber parts and things of that nature. And I think we're going to learn more about that right now. So I don't think masks are a priority right now.
Yeah.
They're a
Okay, so
priority for the hospital.
yeah, so staying healthy at home, and it's important to keep healthy during hard times. One thing that I do want to start off with is that there's a lot of information going around about the disease, but also a lot of misinformation as well. So you hear rumors about this or that, people thinking that physical distancing isn't going to do anything, or even people who believe the entire disease is a hoax and it's just an excuse for the healthcare system to get funding is something that I've heard as well. And these are just bizarre sort of news to me, bizarre information, and we have to make sure that it's important to stay informed, but it's even more important to know what is trustworthy information because it's probably more damaging to be misinformed than not informed at all. Um, so there's a few websites that we can use to check our validity of other websites. If you read up on a website that says the coronavirus is fake, right? You can check the validity of the website and how credible is this website. There's this one website called trustortrash.org. So this is what it looks like, and it goes through a bunch of questions asking you about this website. Who said it? When did they say it? How did they know? These are ways that, so if you just go on trustortrash.org, it takes you through a bunch of steps. This is just the first step, and then it takes you through additional steps as well, right? So it's going to take you through a total of between 9 and 15 steps to ask you about this website to know whether it's true. Another thing that you could do is just go with the KAPOW acronym. So if you're looking at any source of information, right, if someone's feeding you this misinformation, ask yourself about currency, authority, purpose, objective, and writing style. So currency, how current is it? Is it old information or is it new information? Authority, who created the site? Did they have any references? What gives them the authority or credibility to say what they're saying? Is it just anyone at home who perhaps isn't educated in this topic, or is it a doctor who perhaps knows what they're talking about? Purpose, what was the reason for the website? Are they actually trying to help people out or are they just trying to scare people? And what's the objective? Is it biased? Are they trying to make money? Most of the time you'll hear, and this happens to me a lot when I'm listening to the radio. I'm going to hear something about how, diabetes is very hard to cure, but this one new cure, which is this naturopathic cure, is going to solve everything. So just subscribe to our medicine and you'll receive it every month for uh, a rate of only $99, like a month or something like that. And then they leave the $99 part until the end. The second money's involved, chances are, it's probably not as credible because they're just trying to make some money at that point. And writing
And
style, is it?
I think what
Sorry,
we're
Dr.
going
Kenny?
to learn is good. See, I just touched myself again, so I got just yell at me every time I touch my face, everybody. Um, science is science, and all the science right now from COVID-19 is based on observational data. So it's not the best science. The best science is something called randomized controlled trials. Um, and there have been, like Trump has recommended, anti-malarias as a therapy. The answer is, do they work or not? Is that McMaster and others, the World Health Organization, have launched what we call randomized controlled trials, where you will get real medication or fake medications, and you'll be evaluated in a proper fashion. That is the gold standard to see if the therapy is better. It takes away all the biases. Um, and I think one of the things that we all need to learn is that we're learn how to better evaluate um, um, therapies and what we buy and things of that nature. Everybody has an opinion, but science has science. And so we try to use the best of that, and you're going to see some changes about that. So one of the things I didn't realize is how much I'm influenced by, Google searches, how much I'm, if you Google something, usually look at the top three selections. Is it credible or not? Did someone pay to get to that Google search? Are they trying to sell you something, as Paul was telling you yesterday? So this is a good instruction. We learned that elections can be influenced. Um, and that we'll get the science right. So let's learn and look at reputable sites. Um, I will tell you what I know. I spend my life thinking about that. Do I know everything? Absolutely not. Do I learn more? Absolutely yes. And I'll be glad to share that with you. You know, if you think smoking is good for you, you think high cholesterol is good for you, good for you. Science is the science. So there's not much more I can say if you don't follow by science. Um, and so this is a good lesson, and let's learn it.
Right. So,
This
you
applies
know,
to everything.
yeah, there's a lot of information out there, especially in this time of the year, but it doesn't only apply to COVID-19, just anything that you hear as well. Just be careful that you're not believing something as soon as you hear it as well. Um,
When COVID's over, remember what you learned.
yeah,
Look at what Paul's telling you.
yeah. And so the next thing that we can get to is staying physically healthy at home as well. Like Dr. Cooney said, he's been going on bike rides. Um, Thing is, we're a lot of us are stuck inside. That doesn't mean that you can't go outside for some fresh air as well, as long as you're keeping your distance from other people. So staying physically healthy is a good way to, not let the days just pass by. It keeps you active, keeps you off of your bum all day. So perhaps look into getting some resistance bands. If you have some at home, you can use those. Bike riding is fantastic, like Dr. Kearney has been going on bike rides. Walking is another way. You can just go for a leisurely stroll, or you can go for a run if you're able to run. And as long as you're just keeping the distance from other people, so the 6 feet. One thing I've been going on runs recently as well, and it's a little bit awkward
Nice.
because two people, like I'll be running one way and someone will be coming the other way, and we both sort of we move to our appropriate sides to keep some space between one another as well. So if you are going for a walk or if you're going for a run, be careful if someone's coming the other way. Just leave some space between you two as well.
The CN Tower ride tomorrow is canceled.
Yeah.
And our Shadok stairs are canceled. But your walk, go back one a little bit. Um, is that the number one benefit from exercise going from nothing to something. I'll repeat that. The number one health benefit from exercise is going from nothing to something. And going from something to being an Olympic athlete or riding your bike 30 kilometers a day um, is not as beneficial for doing something. The first day of this epidemic, I just stayed in the house and then carried my lovely wife, kick me out, go for a bike ride. And I've done that every day since then. It's the best thing for my sanity. It's the best thing I can do for my health. And while I don't have any randomized controlled trials saying that biking for 1 to 3 hours a day will make me live longer if I get this virus, um, it's certainly not going to hurt being in the top physical condition you are. We learned that things like atrial fibrillation, that heart disease, diabetes, overweight increases the chance of you dying from this disease. Um, Surely maintaining good health, getting healthier, uh, gives you a much better fighting chance. And again, for most of us, this is going to be a non-issue, but you know what? I'm going to stack the odds in my favor and your favor too as well. And I feel a whole lot better.
Yeah.
And maybe
So
one day you will too. For those, I feel sorry for the people who don't get the benefit of activity.
hmm And if we're at home, now we're staying home. It's a pretty good time to pick up some healthier habits that you can keep with you after this pandemic is over as well. So take what you have now and use it moving forward as well. So there are some ways that you can exercise at home if you are perhaps too worried to go out, or if you live in a little bit more concentrated area and it's you can't really keep your distance from other people. You can do some sofa workouts. So on the sofa you can go for 3 sets. Go for 20 squats, 10 sofa dips, 20 climbers, side to side leg raises and leg circles. So 2 minutes between each set. There's some levels here, so if you're level one, you're just starting off, like Dr. Kearney said, nothing to something is still better than nothing at all. So you can go for 3 sets, and as you get more advanced, you can do the amount that you're doing. Stairs workouts are wonderful. Unfortunately, tomorrow was supposed to be the CN Tower climb, but CN Tower climb has been canceled. With that being said, the stairs workouts are still very you can still work out with stairs at home. Dr. Cooney's brought his cat now. That's wonderful.
Tigger, hello. So Tigger's our newest kitten. Um, this is another rescue little critter here. Very curious. And remember, follow your curiosity. So it's Tigger over here. So Tigger says, hello, everybody.
It's very cute. But yeah, so use what you have in your home to your advantage as well, whether it's stairs or chairs or whatever you need. You can do a lot of body weight exercises. Stairs are fantastic. We've been doing Shadok stairs as well, and CN Tower climb is canceled, but you can still have our own CN Tower climb in our home now.
I look
Um,
forward to going back with walk with the duck with you, to walk with your friend, neighbor, spouse. Keep your distance, but do it.
yeah. So eating healthy is very important as well, and being stuck inside all day, it's really easy to get into or fall out of the routine of eating. And I've noticed this myself. Normally when I'm on campus, I'll have 3 meals a day. I'll have a small breakfast, a lunch, and a dinner. Now I'm home and I'm next to food all day long. I have
Just
I have access to
put
food
your hand again,
whenever I
boy.
want. Yeah. So I now the problem is I have access to food whenever I just walk to my kitchen, and that's something you have to be really, really careful of. So make sure you try and keep your regular meal times. Try not to just eat whenever you get bored as well, because that's something that a lot of people fall into as well. So there are some things that we can do to make sure we're eating healthy during this time as well. And here we have what a standard plate should look like. This is from the updated Canada Food Guide. So 5 to 10 servings of vegetables a day. Half of your plate should be vegetables. One thing that I love about vegetables is you can eat so much more vegetables than other foods for the same amount of calories. Like half of a muffin half of a chocolate chip muffin is 200 calories, whereas at the same time you can get three full heads of broccoli for 200 calories as well. So I don't know about you, but I would rather have three full heads of broccoli than half a muffin. Um,
I'd rather have three muffins, but I don't want to be don't want to go right. So one of the things is that you put very carefully here is that if you're not very active, 1,500 calories is your daily caloric requirement. That's not very much. And if you want to lose a pound, it's 500. How to lose a pound again, Paul? How many calories get
it's
to
five
sacrifice?
hundred a day, so 3,500 a week.
Yeah. So if you want to lose weight and you're not exercising, you got to be down to 1,000 calories a day.
Yeah.
I don't know about you. I think that's impossible for most of us.
Yeah, which is
And
why exercising is nice because then we can eat more too.
yeah. So and again, if you're worried about contamination of the food, wash them. And then what you can do is store your fruits and vegetables in the fridge for 3 days before you eat them.
Right.
Or if you keep the food out there as well. So thank you, John. John Deacon told me that, and Dr. Ganguly told me that too as well. So that makes perfect sense to me.
Perfect. Um, Now, some other things that we can do as well is to meal prep. You can cook your meals in advance and you can portion them out to make sure that you're not eating too much at once, so you have your portions set. And soups are really great. Actually, my family just cooked soup yesterday, and now we can have soup, consistently throughout the next few
Is that your
days.
fridge? That one
No,
from
it's not mine. It's not mine. Unfortunately not. But one thing that I do like that you see here with these jars and stuff is you have prepared, ready to go healthy snacks. So a lot of people, like I said, eat because they're bored, myself included, and a lot of people eat because they just have unlimited access to food now. So you can avoid the negative consequences by preparing some healthy food. Cut some vegetables, cut some carrots or broccoli or celery or whatever you want, and have it ready in your fridge so that when you feel like eating anything, you can just grab it and go. Um, Last thing is perhaps organize your fridge. I have this picture here. I wish it was my fridge, but unfortunately,
yeah. So
I'm not that organized.
one of the interesting things is that we're doing this workshop with Forks Over Knives. We got this course, and one of the exercises, we were supposed to take a picture what our fridge looks like. I'm gonna go take a picture of my fridge. I'll be back in a sec. You keep going.
Right. But yeah, so you can, it's a good opportunity to build up some healthier habits. You can keep the healthy food right at the front, so that's the first thing you grab, and you'd feel a little bit guilty moving away the healthy food to get some of the unhealthy food as well. Self-care and mental well-being, this is probably one of the more important or most important aspects of this whole situation right now too. We have to be careful to make sure that we're still taking care of ourselves and staying connected with our friends and family during a challenging time. Remember that you're not alone. We're all sort of going through this as well. Take the opportunity to get some fresh air, even if you can't go outside too much, whether it's on your porch or in a backyard or you go for a walk or even opening the windows. Get some fresh air because it really does help with your sanity. I was going for a run yesterday or 2 days ago, I don't remember, and I was on my porch, and I just saw these two friends or these elderly friends that I see around in my neighborhood quite often. They're still going for their walks like they used to, but they kept 6 feet between each other, 2 meters between each other. So keep in contact with your friends and your loved ones, but make sure you are still wary of of your safety of one another. So keep your distance. Take care of yourself. You can keep in touch through online methods as well. So phone calls or FaceTime, Skype and video calling is a huge thing now. I'm sure if you've joined us for this webinar, I'm sure that you could figure out how to FaceTime or Skype a friend too. Um, and it's very easy to feel anxious and stressed in this time as well. So this is where we're going to talk about mindfulness and meditation. That's something that I've been doing for on and off for a few years. And some apps that I do recommend in terms of, calming the anxiety and the mindfulness is Headspace and Waking Up with Sam Harris. So if you Google Headspace, if you Google Waking Up with Sam Harris, you can find some sources for meditation as well. And last but not least, feel free to pick up a long lost hobby or a current hobby. It's very easy to feel bored and feel like you have nothing to do. So um, make sure you keep yourself busy and try coming out of this situation with um, some more on your belt and healthier habits that you can move forward with.
Puzzles are good.
So,
Uh,
Paul, I just texted you a picture of my fridge. So, if
right.
you have a chance to put that up there, I want people to criticize my fridge, what they like about the fridge. I didn't realize we were going to take pictures of fridges. Uh,
Okay. Here,
so
I'll put it up here now. Uh,
one of the things that's really important is that to think about this. So, to me, this new virus is an opportunity for all of us in the future. This virus will pass. We'll have other obstacles. So to me, this is the time that we're sharing Friday night. So um, reminds me about, I guess, 40 years ago, I would be watching MASH on a Friday night. Now I'm um, grateful for Paul for putting all this webinar and for all our staff and students and all of you too as well. Um, so there's the fridge. And I want some comments if what people think. So you can see we have the egg whites there. We have um, one of the things on the far right there is that we have maple syrup over there. So maple syrup is not a health food. You can put the arrow on the maple syrup there. That's
yeah, I
uh,
got it here.
we had some whole wheat pancakes and stuff, and where my daughter had lots of maple, so I just had a little treat. Right in the middle over here, if you go right to that's straight over here. So we have um, fair amounts of fruits and vegetables. The eggs are I don't eat eggs myself. I eat egg whites. Try to do that. I have we have
So
lots of celery, lots of potatoes. And this is some wheat germ over here. So up on top over here, so lots of fiber. So trying to work at it. If it was up to me, you mentioned having a half a muffin, I would have 16 muffins. But I want to live a long time. I want to get my weight down and stuff. So that's my fridge, the good and the bad. What's your fridge like? And one of the exercises is that next time you come to the office, take a picture of your fridge and bring it in. We'll take a
Yeah,
look.
we can see what the fridge looks like. So it's a good challenge to pick up some good healthy habits for your fridge as well.
It's not as clean as that one there. So is it time for people to open up to some questions? Anything else you wanted to add to that, Paul?
Yeah, no, that's about it. So that's all we have for you. If there's any questions, we've been answering questions as we go as well. But if anyone else has any questions, we can take some
And
time to
also,
answer those now
any
too.
thoughts? My first thought is that we all should. I'm going to clap and applaud Paul for putting all this together.
Thank you.
Um, and
it was really good.
Thank you.
one of the things is that one day I want to work for Paul. And I want to be his volunteer. I want to be as helpful as he is. He's done some amazing things, and there's just so many people I want to thank. First people to thank is all people from the stores, for all the healthcare providers. But I'm going to think too as well is that I feel very grateful for all the discussions I had with you. The thing that frustrates me the most is that when people don't try, and is all I care about is not being successful. I care about trying. And I'm not the person I want to be yet. I still have a lot to get better to improve on. Um, and so I know you want to do the same thing too as well. One of the things to think about if gives me opportunity to reflect is that I'm 60 years old. I hope to be practicing when I'm 100 years of age. I don't know if that I'll make it to that or not. I also know that if I get sick from this virus or other diseases, and and that there's limited resources, who should it go to? And I would feel very bad as someone who's younger, healthier than I take a spot when a 20-year-old can probably benefit more. But I would be very annoyed if that 20-year-old doesn't use their life to make the world better. I'm going to try whatever time I have left to do the best I can for all of you. And if we all had that attitude, we'd be in a much better place. And this opportunity is a time for reflection. So my reflections is that I'm going to go for a bike ride. I'm going to try to use this telemedicine. I'm very grateful for all your friendship and allowing me to be your doctor, and I will continue to do the best I can for everyone, and I know you will too as well. This would not be possible if it wasn't for all our students, our staff, and all of you. And a special thanks to Paul. I don't give special thanks right now to Jen there, who's I don't think has turned off the phones from her house at this point in time. And at times I get frustrated. I don't know what to do. My internet doesn't always work. And the thing that frustrates me is not being able to see people as healthy as they can be. So let's all be a little bit healthier and make the world a little better place. And, for those that...
Thank you.
Thank you. Any thoughts, anybody?
For a telehealth appointment, would be good to have blood pressure already taken or before the phone call. I have a machine and I take it every day. So
well, you can see that's my dog over there just saying is that before I speak to you, make sure you have your blood pressure, vital signs, and your list of questions already formatted, or my dog will see it.
Okay.
Look at that video that Paul.
Yeah, I got it there. Yeah.
I'm trying to be helpful. Is that and it's good to be prepared. If you don't have a blood pressure machine or a scale, get one at some point in time.
No, I have one.
Yep. But no, a lot of people, say, "Oh, it's in the barn, it's in the garage, it's that don't have batteries." We all have to do things better, and do things differently, and all work together. Right now is that the internet is not good enough where I am right now to do video conferencing with patients along with my electronic medical record. But I'm grateful still being in communication. And the best time for me to be in communication is between 7 and 10 in the morning when no one's on the internet yet. So I can get better times as the day goes on. The internet doesn't work as well. But use the website.
That's why his voice will stop.
And call the office as well. And those I have my cell phone too that people have to as well. I find it sometimes hard to multitask 5,000 things at the same time, like one thing at a time, but I'm learning to do things a little bit differently. What was the next question that I heard? Sorry, someone else was saying. So does that make sense? Just to let's all work together on this. Absolutely. And so, Mike, how many pounds do you want to lose?
Who, me?
Yeah.
Oh, I'd like to lose about 70.
Okay. So how are we going to do it?
Well, I'm out. Around the Bay race was this past week, and instead of doing that, I did a 7-kilometer hike. So,
nice. Okay.
And we're going on bike rides. That's what we're doing.
Nice. Good deal.
Other than that, we are not going to any public place. See my kids or grandkids. Not seen them for like a month.
Yeah.
It's hard.
I remember Joanne was talking to me that how she's reading to the grandkids at nighttime. So we're all doing different things. And I thought that was a wonderful story. And we're talking a little bit about what's going to happen in nursing homes. I feel bad for people in nursing homes right now because they are isolated. They're at higher risk. And if you should get sick, what should be your choices? I'm not sure if Philip wants to make a comment or Joanne wants to make a comment on the nursing home situation.
Can you hear me?
Yeah, we can hear you.
Okay. Well, yes, it's I think they are putting like an iron. Today they mentioned they're putting an iron ring around nursing homes because the patients are so vulnerable. Andrew Picard wrote an article in the Globe this morning that upset people, saying take your loved ones out of nursing homes. But maybe they're safer there, and a lot of people couldn't take care of their nursing home patient, a nursing home patient. It takes a real skill to take care of very ill people when they get to that level of care. And the only other place they could be taken care of is an emergency department, where most of them, that wouldn't be the place for them to go. I think they're doing all they can to protect these vulnerable people. They're screening. They've got, so far, PPEs. I'm doing my care virtually, 98% of it. It's worked out really well. We've had to go a few times. And so hopefully in Ontario here, we'll keep it out of many homes. It hasn't been successful completely, obviously.
And I thank all the staff and all the people that are working there. It's really hard work and very important work. Thank you for all your efforts there. You want to make a comment about end of life decisions and things of that nature?
Well, I think we all need to decide what we want to happen to us if we get to the point that we can't speak for ourselves. And we should let our loved ones know if we got to the point that resuscitating us wouldn't bring us back to the way we want to live, then perhaps don't put us through that procedure that could cause a lot of harm and being undignified. I think with nursing home patients, they're lucky in that we discuss that with them, their families, when they first come in. And most of these people have terminal diseases, be it Alzheimer's disease or Lou Gehrig's disease. But ourselves, as we're heart patients, a lot of us, we need to have that discussion with our wives or husbands or family members. What would we want done if we had a cardiac arrest? There's a lot of brain damage. Do we want to be brought back to a life of living in a vegetative state, or would we want to be just to have a natural death? I think if you take that up with your family and maybe get your health care professional to go over that with you, that could do everybody a big favor, because they'll know your wishes if you get yourself into that predicament. I always said to people, what would grandmother say if she could jump out of that body, turn the clock back 50 years and see herself lying in that bed? What would she tell you to do? And then they seem to maybe give those answers. So something we all have to think about or get as the clock ticks on.
Thank you for sharing that, and thanks for your hard work. Anybody else have? And if people, I think it's important to actually write down some of the things that are important to you. Let people know. But writing down is important to do that. So there are all sorts of advanced directives, but it's just sort of thinking about if my heart should stop at this stage in life, I don't want any operations. I don't want breathing machines. Well, you know what? I still feel good. My quality of life is good. I'd like full resuscitation. One of the things that this disease makes us think about is that, as John Deacon was telling me the other day, is that we're all going to die, and how do we make that decision, what to do and not to do, is an individual choice right now, but that can change. There may be laws in Canada put in place. If the system is overwhelmed, you will not be given a choice potentially. Decisions will be made on people that have the best chance of survival, and people that should healthcare people be put in front of the line because they're sacrificing, or people working in retirement home be put in front of other people that are contributing. I'm not here to make those judgment calls, but there's a whole bunch of ethics behind this. I know from my personal perspective is that I have a lot of living left, but I also would feel bad if someone such as Paul and other people who are a third of my age are not getting that opportunity. But I would expect Paul, I know Paul will, make the planet very good to everybody else. And if you've been given that second chance, take advantage of it. Make the world better. Any thoughts from anybody else? And any questions coming up there on YouTube there?
I think things have settled down there. Just a lot of thank yous for your dedication and enthusiasm, Dr. Kernier.
You're only as good as the people around you. So, Paul, remember what's that Harvard study? The people who live the longest.
Yeah. So the Harvard longevity study is showed that the people who live the longest are those with the strongest social connections as well. So strongest relationships, strongest connection with other people.
So the people who live the longest is not people with the most, who are the fittest, who bicycle the most, who have the lowest cholesterol, people who have the best quality and number of quality relationships. So to me, you're all very important, and relationships are important. So I want to make sure that you all stay as healthy as you possibly can and get healthier. So for the next little while, we're going to be doing things differently. We're going to have a blend. If I can help or any of our team can help, please let us know and we'll do the best we can. I know these are trying times. Again, thank you all for attending tonight. Thank you, Paul, for putting this together. And we'll put this up to share. We have a few glitches to work out, and we're going to meet every Friday instead of MASH right now, which is Mobile Army Surgical Hospital. We're just going to get healthier every Friday nights on at 7 o'clock and share some stories and thoughts, and hopefully have some bonding here. Keep well,
Thank
keep
you.
healthy.
Yeah.
Have a great night. So thanks again.
So much. Thank you.
Thank
Thank
you.
you, everyone.